Hey family, it's Dr. Yola. You know, when you're seeing me outside of our Wednesday night Facebook Lives, there's something going on, right? There's some late breaking news that I want to address. And that late breaking news is this new report coming out of the CDC that the Washington Post published on last Friday. The war has changed in terms of how they are approaching those of us who are vaccinated. One, I want to address what those findings are, and two, sort of how do we interpret them? How do we know what to do next? Especially when I've gotten a ton of questions, especially from those who are not vaccinated, saying, see, everybody who's vaccinated is getting COVID anyway, so what's the purpose of us getting the shot? Well, we're going to answer that question in a few minutes, all right? So let's first talk about what did this CDC report reveal. The first thing that it revealed was just how much of a risk the Delta variant is to us all. But what it also revealed to the CDC is that they needed to change their guidelines, right? So what we know is back in June, when the CDC started changing their guidelines, telling those of us who are vaccinated that we no longer needed to wear masks outdoors, and then we no longer needed to wear masks indoors. And then they said, if you are vaccinated and were exposed to COVID, you didn't need to quarantine, you didn't need to get tested. Well, guess what? This report on Friday reveals that that was not correct, right? But what we have to understand, and this is certainly not to make an excuse for the CDC, do I think that they made a misstep in making these recommendations? Yes, I do. I have told people since vaccines were out, I don't care what your vaccine status is, you still mask up, especially if you're indoors. And if you have been exposed to COVID or been put at risk for possible exposure, you should still quarantine and still get tested, even in the face of being vaccinated, because there were a lot of things that we just didn't know. So back when the CDC made these recommendations, it was really based on the behavior of the original COVID-19 virus and the Alpha variant, which was the most dominant COVID-19 that we were dealing with, the most common viral mutation or variant that we were dealing with at the time. Based on that information, they felt comfortable because some information from studies here in the United States, they looked at two studies particularly here in the US. One was in a screen for patients who were getting ready to be admitted to the hospital for an elective procedure. Those who were vaccinated and exposed to COVID were 90% less likely to test positive. Therefore, the CDC extrapolated that there was a 90% less risk for COVID infection in the face of exposure among those who are vaccinated. They also based their recommendations on data that they got, particularly in Israel, looking at those who were masked up but vaccinated in hospital settings, and what their risk was in terms of COVID-19 exposure, especially in taking care of patients. But that was with the Alpha variant as a predominant source of COVID-19 infections, and a little bit of some of the other variants that were floating around. That was before the Delta variant showed up, right? So these recommendations were being made right as India was in the throes of what was probably one of the worst outbreaks of COVID-19 globally. Out of that outbreak came the Delta variant. So these guidelines in the United States showed up right around the time that the Delta variant just started. So we didn't know what the Delta variant was going to do. And this is a perfect example of how science works, right? So someone posted recently, science isn't the truth. It's gathering the data to understand what the truth is. Now, in science and in medicine, that truth can pivot a little bit. It can change. It's no different than when I have a patient coming in, right? And you come in with a cough. I look in the back of your throat. It looks like your sinuses are draining. I say, okay, you look like you have allergic rhinitis, allergies. But then you keep coughing even after I give you some Zyrtec. And I say, you know what? I'm going to get you a chest x-ray. And then based on the chest x-ray findings, I learn more about what's going on. And then I give you a different diagnosis because I have more information. It's the same thing the CDC is working through. With more information, particularly from the report on Friday, they now realize that they have to pivot the guidelines that they pushed out. This is, fortunately and unfortunately, all of our lessons in how to maneuver through public health. There is nothing exact in this except for the fact that it will likely change as we get more information. And that's what's happened with the CDC. Now that we know across the country and across the globe how the Delta variant performs, how it acts compared to the Alpha variant, the Beta variant, the original COVID-19, we know that this variant requires more strict guidelines. Again, I would have kept masks on people whether they were vaccinated or not from the beginning. I would have had people who were vaccinated still quarantine and still get tested when they were exposed or likely exposed to COVID or did not know if they were exposed, but there was a potential, for example, if they got on a plane or in a crowded environment like going to Lollapalooza, you best believe I would recommend, even in the face of a vaccine, that people get tested. So guess what? Based on information that the CDC acquired just recently, they realized that they need to change their guidelines, that for those of us who are vaccinated, that there's still a risk of us acquiring COVID-19, which we already knew. But what they learned in this report specifically, and we'll talk about the specific findings, was that those of us who are vaccinated can shed just as much viral load as those who are not vaccinated. That does not mean that we are at equal risk for infection. Completely different difference in terms of that information. What we know is that in the face of exposure, when the virus enters into our nasal passages, into what we call our oral pharynx in the back of our throat, inside with the Delta variant, there's 1,000% more virus compared to the original COVID-19 virus, which means that even if my vaccine works and my body's able to fight off COVID from invading my body, because it's still what we call colonizing my body, or I'm a carrier, I don't get infected, but I can spread it. We now know based on this report that those of us who are vaccinated can still be the spreaders of COVID-19. Hence the need for us to wear a mask, hence the need for us to get tested, hence the need for us in the vaccinated population to still quarantine. And I know you're gonna say, oh my gosh, Dr. Hancock, if you gotta do all that, then what's the purpose of getting vaccinated? I'm glad you asked. The purpose of this vaccine was twofold. The first was to make sure you do not get critically ill from COVID-19. The second was to make sure that you do not die from COVID-19. This vaccine in the clinical trials, the data did not report out that once exposed, what was the percentage of people who later developed COVID? It was, did you get a significant illness once you were exposed, and did you get hospitalized, right? What we learned later on as more people got the vaccine was how well it protects you from infection once exposed. Simply because you're exposed to a cootie, COVID, flu, etc., does not guarantee that you're going to get it. But in the face of a vaccine, it takes that risk down even further. So once a lot of us were getting vaccinated, they were able to collect data to determine, if exposed, how well are we protected from then becoming infected. They already knew based on the clinical trials how well protected we were from getting the infection and it being severe or requiring hospitalization or us dying from it. The question that needed to be answered, which is answered now, is how well does it protect us against the infection once exposed? We're continuing to get that information, but from the preliminary studies from the United States and from across the globe, it showed that there was significant decrease in risk of infection in the face of exposure among those of us who are vaccinated. But what this report revealed was several things. The first thing that it revealed is what I just mentioned, that those of us who are vaccinated can shed just as much virus as those of us who are not vaccinated. It doesn't mean we're at same risk for infection. What it means is that when we are exposed and the virus is hanging out in different parts of our body, we can push out, spread out, sneeze out, cough out just as much virus as the person who's not vaccinated. So that means we need to mask up. The second thing, especially out of the cases of Massachusetts, was that there is a risk of those of us who are vaccinated in getting the COVID-19 infection, right? So we know that with the Pfizer vaccine, it being around 96% effective, if 100 people got the vaccine, 4 people are still going to get COVID. With the Moderna vaccine, with an efficacy of 93%, of 100 of us, 7 of us are still going to have an infection, right? And with the Johnson & Johnson vaccine being around 72% effective, that still means that about 28 people are likely to get COVID. Now, what it doesn't mean is that we're going to have the same level of illness and the same risk of hospitalization and death as those who are not vaccinated. That is significantly reduced simply because we are vaccinated. So what you saw in Massachusetts was just a perfect example of why we collectively still need to mask up. And it isn't that the vaccine is failing, it's that this Delta variant is like the biggest, baddest version of COVID we've dealt with. In some cases, it almost seems like a whole nother virus, right? But we do know that Pfizer, Moderna, and Johnson & Johnson are effective against the Delta variant. But what we also know, based on this new report that was released on Friday, is that the Delta variant has 1,000% more viral particle release, What we also know with this Delta variant is that it causes more infection. We define that by the R naught, R sub zero. That tells us how many people can one person infect. When you think about the original COVID-19 virus, one person could infect 2.5 people in 5 days. With the Alpha variant, one person could infect almost 4 people in 5 days. It's estimated that the Delta variant of COVID-19 can infect up to 8 people. One person can infect up to 8 people in the span of 5 days, which is why they compared it to the chickenpox, which has an R naught of 9, meaning one little one can infect 9 people in a short amount of time. It's more infectious than Ebola. And they say that, and it sounds like hyperbole, and it sort of is, because the reason why the R naught for Ebola isn't as high as COVID is because once you get Ebola, you're so sick, you're not around a whole lot of people to cause them or to allow you to spread it to a lot of people. It knocks you down so quickly, you don't even have time to spread your cootie. That's one of the reasons why Ebola does not have the same R naught as COVID-19, but it certainly has more severity. So we're talking quadruple the rate of infection for the Delta variant compared to the COVID-19, the original COVID-19. And so, of course, with the Delta variant, you're going to see more breakthrough infections in the midst of, or in the face of having a vaccine compared to where we were with the original COVID-19 virus. The study, the clinical trials, phase 3 clinical trials, and all the data that we have is based on Alpha variant and the original COVID-19. This is a whole new ball game with the Delta variant. And so that's what this report was about, was looking at how infectious the Delta variant is, looking at how many people it can infect, looking at what the risk is for those of us who are vaccinated in terms of how we can also serve as spreaders of the virus. Now, if those of you who were that are not vaccinated would get vaccinated, then we, the vaccinated ones, would not be as risky in terms of being able to spread it. Because the more people who get vaccinated, the fewer people that COVID-19 can infect, and the fewer people that we have to worry about in terms of severity of illness. The other thing that was noted in this report was who is having these breakthrough infections. It's not everybody that's having breakthrough infections. The majority of people who are experiencing breakthrough infections in the face of being vaccinated are our seniors. 75% of those who have had breakthrough infections have been 65 and older. So again, our seniors are disproportionately impacted by COVID, even in the face of being vaccinated. Not because they're at Lollapalooza, but because a bunch of y'all, not me because I'm vaccinated, but a bunch of y'all who have decided not to get vaccinated are now around your grandmommies and granddaddies, exposing them to a bigger, badder version of the COVID-19 than they were prepared to be exposed to, because all of our information was based on the original COVID-19 virus and the Alpha variant. So it's up to us to be our brothers and sisters keepers, so that we are not again putting our seniors at risk, so that we are not again putting those who are immunocompromised at risk, so that we are not again putting our children, especially those under the age of 12, at risk. All right? That's what we have to pay attention to, especially for those of you who are considering, like you're on the fence or you're like, nah, I'm not down with the vaccine.